Princess Claire Canama. So I'm the clinic head here in Cebu Cybergate, Aventus branch.
So we are doing the
Tour
of the entire medical clinic.
for Cybergate.
Okay.
Okay, so first is we'll go to our X-ray. So this is our X-ray room. Our red techs will assist us in case you have some questions. Okay, so this is our X-ray room. So you will do your chest PA here. Our chest X-ray PA for cervical and for lumbar, right? Kung sa setup sa dito sa bed, anong mga X-ray red techs?
Lower extremities, like
Mga lower extremities.
knees, leg, and sometimes the lumbar spine, lumbosacral spine.
So, more on the lower extremities pag dito. So, here is our changing room in case, kasi sa flow namin, yung mga babae dapat naka-lab gown, naka-patient gown sila. So, dito namin pinapapunta, and then here for the lower extremities and for the upper extremities dito. Pinapastan. So, do you have any questions? Wala naman. Okay, so dito yung setup namin for the X-ray. Okay, let's move to the next area. Okay, so this is our room. This is just a small room for the doctor's using. So yung mga computers namin ginagamit when the doctor will read the X-ray images. So next is here our doctor's room. So our doctor's room for the general practitioners. Another one, doctor's room for our specialist doctors, especially the OB. Yeah, here, dito namin yung pinaperform. Another one here, doctor's room again for general practitioners. And since we have ultrasound, we do our ultrasound into the echo. You can come in. So we use this machine. We use this machine for the ultrasound and also for to the echo. So dito namin pinapahiga si patient, and then the doctors will do the scanning. So that would be our whole abdomen, upper abdomen, and also for dito the echo sa heart natin. So this is our ultrasound room. Next is okay, next is the laboratory. So ito yung waiting room namin, waiting lounge area for the laboratory, or our extraction area, phlebotomy area. Here is our releasing of results or the reception for the laboratory. So you may ask the med tech here in front in case you have some concerns or papakuha ka ng dugo or urine and others. Also, we have drug testing here. So we do biometrics in this area. So dito pinapaihi namin yung patient. So merong magbabantay. And then, dito tayo sa loob. Maraming mga machines here. So, we have different departments. Okay, you can come inside. Medyo na pa sila sa releasing area. Okay. So, this is our laboratory. So, this is divided in many sections. So, we have the drug test here. And for the clinical microscopy, dito yung pag-process ng mga ihi and tsaka sa stool. Also, we have some, this is the room of our pathologist. Here, this one, pathologist area. So, dito siya nagbabasa ng mga pap smear niya. Also, may mga machines kami dito for thyroid panel test. Ito yung mga machines ginagamit namin for CBC. Dito namin pinaprocess. So, usually ginagamit namin to for clinic base. This one tong maliit. And then the big one is maramihan. Merong ang mga medtech namin nandito para in case na may mga questions kayo. So, we also have our pathologic room. So, dito nagsistain yung mga medtechs natin, staining purposes. Dito sila sa room na to. And, here, dito yung chemistry namin. So, yung mga fasting, mga sugar, mga electrolytes, sodium, potassium dito, tinatest namin. Ito yung lugar namin dito for that. And we have different kinds of refrigerators. So dito, ito yung ginagamit namin. At saka another refrigeration stocks and also others. So may freezer type, saka meron ding refrigerator type. Okay, for microbiology, this is our room for microbiology. So we can come inside. We have our biosafety cabinet here. We do the COVID test. Dito ginagawa yung test kasi airborne yung ano eh. So, mas safe siya pag may cabinet, biosafety cabinet.
So, gigamit na during COVID time. Karon wala na.
Meron ding nagpapatest ng COVID for rapid test. So, ginagamit pa rin namin. For safety. Oo. Okay, so, ito yung ano namin. Fire exit. Ito yung sterilization room namin. So, dito may autoclave kami. And also, shower room. Shower room in case na merong mga spillage na or accidents. So, pinapapunta naman dito in case sa mata. Para diretso ma-wash nila. So, ito lang yung for laboratory. If you have any questions, you can ask our laboratory.
Ang laboratory result ninyo mo release within the day or
There are some tests na hindi siya ma-release within the day, but some other tests that pwede siya ma-release mga 2 to 3 hours.
Okay. Kanang
Pero some
drug
other
test.
Drug test, 2 to 3 hours. 1
okay.
to 2 hours, that's enough.
Okay lang mangutana ang drug test ninyo pila yung rate dire?
For Cebu marijuana? That 2 panel, that's 300. But all of the clinics, 300 din ang rate for
okay.
Cebu and marijuana na rate sa panel.
Dili kay usual daghan mo drug test, di ba? Kanang mga
daghan na for promotion sa kuan sa DOH or sa diri sila padulong tanan. Oo. So you can
Padagtas
you can
apply og kuan.
film something.
kanong apply ako.
Then we'll move to the next area later kung manamo. Yes. You can do any videos for your vlogs or write-ups. If you have any questions, our medtechs are available to answer.
Di mo ko na question kay kasi kalibutan na yung medical.
Daghan na mo up kining mga customer mga for pre-employment medical exam daghan na.
Yes, usually daghan din pre-employment patients. And also annual physical exam. It actually depends on the rate, ma'am. Kaya usually kung basic lang that would be mga 530. Depende sa package nga ko unlike kung CBC, UA, physical exam, x-ray niya na
Minimum na siya ang 5.
Package ang inyohang mga kuan walay palitan mag gusto lang ko pagpa x-ray pwede ra.
Pwede lang.
Pila sad ang x-ray dire? Pwede ra mo tana dili.
Ang unsa ba siya na x-ray? Daghan ra ba siya kay sa x-ray sir?
Whole body.
Whole body. Daghan na siya og kay
okay.
sa cancer patol.
Ang to the echo.
Today ako yes naasad mi diri.
Pila ang rate sa to the echo?
That would be mga 4,000 plus.
4,000 plus. Okay.
Kaya nasad mi plain magud and nasad mi doctor. Nana siya. Naka-film ra mo, ma'am.
Okay.
Kaya let's
Okay.
sa pinaka tumoy para kanila
So
this is our server room. So nandito na mga
server.
yes for the IT.
Okay.
Our billing is here located sa admin. Kaya ni sila dali di naman kayo na ang mga paperworks and all lang ni sila na sila yung own nila nga room. Here ang lockers located dere para sa mga staff. So ang amuang nga IntelliCare na ami liaison. So usually kanang salikan sa hospital, nagtipok man ang tanan ng mga hospitals dali within Cybergate branch na among liaison dali nakatokas niya. So aside from the clinic or mga OPD na mga pasyente, nasa may ka ng mga outside sad na mag-anhi for LOA. So needed na nila to present it to other hospitals for
So, in telecare,
yes.
side.
In telecare na Vega. Yes. Naabot din na nila yes. Na siya mga, daghan po na siya mga pasyente na ganinya na po din.
Ang data ninyo nga rin, ma'am, like, available for the 21 clinics, like say, ari ko nagpa-lab result test, and then
Yes.
sa Manila, pwede na ko makuha ang results?
Yes, pwede ra. Ingon mo lang na this is the branch nga nagkuha ko test so that we can coordinate with the
Okay.
clinical. Kaya siya, wala rin na siya yung problem. And usually, the tests are available online. So, maka-receive.
Okay.
When you provide a email ad,
Mm.
it will be sent to you mga 1 to 2 days after via online. Like, so, we
ECU.
cater our ECU patients, so
What is ECU?
executive.
Executive.
You can come inside. Oh, you can come
Musuway sa
inside.
taguan,
Medyo cold
executive.
lang. Yeah, so this is our dili stay ang mga ECU ginakuan siya og blood. There siya na mo palangga. So gina take care. Yes. Kay mura pud ang among
So
service na
may
sila, ha.
TV pa.
Yes, gabi po na sila dia of
Netflix or just cable?
mga save videos
Ah,
na
okay.
updated. Save movies.
Executive good.
Executive sila. So they bring their, sometimes their families, kaya uban mo sila together, diri mag-test.
Ah.
So, muna.
Sumura ang kami.
Corner, so nandiri ang mga updates gahapon regarding the mga trendy ron na mga sakit na ato ang karon na summer heat. So what will you do? Mga postpartum whooping cough like last month, then mga childhood cancer and all. So we will cater our patients here. So muna siya ang lounge area. We will the patients will sit here and then naaman may guard queue. So we will just give them the number for consultation ba siya, for diagnostic and all. And then the nurses, here are nurses. So they will assist you. We will register the names of or the details of the patients here in our computer. And then we will do vital signs. After everything is processed, we will do vital signs. So, vital signs consist of patimbang na mo sila, ang ilang nga height, ilang nga BP, ilang nga RPR, and all. So, kini mo ni among mga doctor's room, in case na diri mo doctor's room na mo, kani mo ni among mga ECG. So, ganina, ang ultrasound ko siya, kani siya may siya among ang ECG machine nga ginagamit for the patient. Yes, here. Napagdaro sa ECU.
Sir, ayan, napadiri dagat.
So, muna yung mga ECG room. So, dari, ginapatindog na mo ang patient para sa yung Snellen chart. Check niya kung walay problem ang mata or kung sa kadulan niya makita. Kani, another room sa niya siya for our surgeon. So, usually, diri ang amo ang surgeon doctor, mag-change of dressing, kung na ay mga kinahanglan tahion, diri niya ginabuhi.
Wala na mo yung surgery diri, no?
Wala.
Wala.
Wala may mga minor din na surgery,
Minor.
but kanang naalag ka ng change of dressing, suture, nakatanggal sa mga kuan. Okay. So, muna yung processing area. So, we do our processing here lang sa mga PPE, for employment, especially sa mga paperworks, kinahanglan nga i-process para mapadala ng sa company. Ang amo ang clinic, mga rooms,
Ibaw na taas sa tagad.
Oo, pamalo na ka mo. Oo. So, in case you want to have appointments, we will remember everyone. Oo.
Thank you.
Yes, for sure. Thank you. Do you have any questions? My questions? Wala na.